Today, I have come to talk to you about the symptomatology and examination of the eye. In general, if we are in our practice, in your day-to-day general practice, we will see that there are quite a good number of patients coming with similar symptoms like decrease in vision, redness in eyes, watering, discharge, pain in the eyes, or some swelling on the eyelid. But you must have noticed that all of them may not have the same diagnosis. To make a diagnosis, we have to correlate history, symptoms, and the signs. If we don't examine properly, we'll miss the signs and so the diagnosis. While examining, one should look for not only the abnormal signs, but we should also make a note of the normal findings within the eye. We should document the findings because documentation helps in the follow-up of the case, and also if we have to refer a case to an ophthalmologist, it will be easy for him to manage the patient. Now let me share a few cases that I have seen in my practice. Here there is a patient, a 20-year-old female who comes to me or who can come to you in your general practice and tell you that she had a sudden onset of redness in her one eye, say right eye. Now when you ask her a detailed history, she might tell you that she got up in the morning but she could not open her right eye. She found it difficult because her eyelashes were matted together. She tried forcibly, with slight force, she tried to open her eye. When she slightly opened her eyes, she could see that she saw colored halos in front of her eyes. She could see some colored halos. She went to the washroom, she cleaned her eyes, and then she noticed that her eye was red. There was slight discharge in the eye, but her vision now was completely normal. If you examine this case, what will you see? You will see that the conjunctiva is red, the cornea is pretty clear, and the pupils in both the eyes are reacting normal. Now, I will go to the next case, that is the second case, where a middle-aged lady comes to you. She too complains of acute redness in one eye, say the right eye. But here the redness in the eye is associated with marked pain, severe pain. The pain is so severe that the lady says that she's having headache on the same side as that of the involved eye. Now the pain is so severe that patient might also tell you that she had 2-3 bouts of vomiting. If you ask her, she might tell you that there is a considerable drop in her vision. In general, if we do not ask the history about vision, or if we don't ask the history about the eye, and if we concentrate only on the headache and the vomiting, there is a chance that you might refer this patient to a neurocenter. But if you examine this case, if you ask the patient to open her eye, or if you assist the patient in opening her eye and then you examine the case, you will definitely notice the cornea here is hazy and the pupil is mid-dilated and it is not reacting to light, it is fixed. So what are the differences and the similarities between the case 1 and the case 2? It is very simple. In the first and the second case, there was redness. It was the common symptom between both the cases. But in the first case, the lady did not have a drop in the vision, whereas in the second case, there was a considerable amount of decrease in her vision. There was pain associated with the decrease in the vision and redness, which was absent in the first case.